Hi and welcome back to another video of Medic Notes. This video will be on multiple sclerosis. Multiple sclerosis is a potentially disabling disease of the brain and spinal cord. It occurs when there are inflammatory plaques of demyelination in the central nervous system, which consists of the brain and spinal cord. And it is disseminated in space and time, which means that it occurs at multiple sites, and there are usually 30 days or more between the attacks. In multiple sclerosis, the immune system itself will attack the myelin sheath that covers nerve fibers, and this will cause communication problems between the brain and the rest of the body. Eventually, the disease can cause permanent damage or deterioration of the nerves. The mean age of onset is around 30 years old, and females are more prone to have multiple sclerosis compared to males, where the ratio is around 3 to 1. These are the clinical features of multiple sclerosis. She can be divided into sensory features, motor, and sexual or genital urinary functions. So for sensory features, you can see that sometimes the patient complains of pins and needles, tingling feelings in their fingers or toes, reduced in vibration sense as well. For motor, there might be spastic weakness or myelitis. And for sexual or genital urinary function, they might complain of erectile dysfunction, urinary retention, or incontinence. And there are also other features where the more important ones are the eye symptoms. So sometimes the patient, actually around 20% of the cases, they present with unilateral optic neuritis, where they will complain that there is pain on eye movement and also reduce in the central vision. Besides these eye symptoms, the bladder involvement are also common. For investigations, depending on the presenting symptoms, some patients may need extra supportive information to make a diagnosis, besides the McDonald's criteria, where I will talk about it later on. So other investigations we can do are MRI of the spinal cord and brain. It is sensitive but not really specific for plaque detection. It can be used to exclude other causes such as cord compression. Can also check the cerebrospinal fluid. A very significant finding for multiple sclerosis would be oligoclonal bands of IgG on the electrophoresis that are not present in the serum. It will suggest a CNS inflammation. And there will also be delayed visual, auditory, and somatosensory evoked potentials. This is a picture showing the oligoclonal bands in the cerebrospinal fluid. This shows the McDonald's criteria for diagnosing multiple sclerosis. So, can be divided into clinical presentation and additional evidence needed for diagnosis. So you can take a look at this table here. For treatment of multiple sclerosis, we give lifestyle advices, ask the patient to go for regular exercise, stop smoking, and avoid stress activities. Disease-modifying drugs like dimethyl fumarate is an option for mild to moderate relapsing remitting multiple sclerosis, whereas the monoclonal antibodies such as alemtuzumab and natalizumab are also approved for relapsing remitting diseases. To treat the relapse, can give methylprednisolone, and for symptom control, depends on what the symptom the patient has. For spasticity, we offer baclofen or gabapentin. For tremor, can give botulinum toxin type A injections to improve the arm tremor and functioning. For urgency or frequency, can teach intermittent self-catheterization. If the post-maturation residual volume is more than 100 ml. If it is less than 100 ml, we can try tolterodine. For fatigue, amantadine, CBT, and exercise may help. That's all for this video. Thank you.